When you leave the hospital, you will be given an appointment as to when to see the surgeon. Usually you will see the surgeon in approximately 2 to 3 weeks. At this time, the surgeon will assess how physically strong you are, how your incisions are healing. He will go over your medications and see what needs to be continued and what needs to be stopped.
The nurses will be going over a lot of the things of what to look out for when you go home. We'll also be giving you a little booklet with all the things to look out for, as well as exercises to do and so on. But just sort of a quick sort of take-home bullet points. Any weight gain, we'd like to know if you start gaining more than 2 pounds in a day. Usually what that means is you're starting to retain fluid, and that can result in you becoming short of breath and so on. There are going to be good days and bad days. So there are going to be days when you wake up and you feel great, and then there are other days where you're going to feel exhausted and tired. In general, though, you should today should be at least better than 2 days ago. So you may have ups and downs, but you should see a progression to improvement. If you're not seeing that or you're concerned, then certainly get in touch with us. And get in touch with your surgeon so we can see where you are. If you start seeing increasing leg swelling, if you have any drainage from your wounds, if you have any redness or increased tenderness in your wounds, any of these things should prompt a phone call to at least let us know what's going on so we can monitor them. This is a partnership. We're with you the whole way through the operation and afterwards. So at no time should you ever feel completely disconnected from your care. Even when you go home, you have our phone number. If there's any problems, call us. We prefer to hear from you early, fix the problem early, rather than find out now we've got a bigger issue. So please don't feel, even though you're home, that you're disconnected from your surgeon or the practice. So anytime, 24/7, 365, you can always call us and we will walk you through it. If we've done our job right, we should have actually explained to you what may be coming up next, what the potential pitfalls are, the next step of recovery, and so on. You will be coming back to see your surgeon after about 2 weeks, at which time, assuming everything is actually healing, which it should do, you won't need to see your surgeon again. But again, if there's any issues, feel free to call us even after that initial contact. You will be following up with your cardiologist and your primary care doctors. In general, especially if you're out of town, we would recommend that you see them early in the process, just so that if you are seeing your primary care doctor, they know what you kind of look like initially after the surgery. So when you call them 10 days later and say you feel lousy, they don't say, well, what do you expect? You just had heart surgery. But they know, you know what, he looked a lot better, or she looked a lot better when I saw them 10 days ago. Maybe something fishy is going on here. So again, try and contact your primary care doctor a little bit early after you get discharged from the hospital. And your cardiologist, we will go over the schedule with you. Each cardiology practice and cardiologist have different time frames when they want to see you back.